Hi, this is Shannon again. I'll be going over PICC line removal. A PICC line removal is a central line removal, so it is a sterile removal. So what you're going to need is sterile gloves, a large tegaderm, a ChloraPrep, and some sterile gauze. If you are doing a central line and it's sutured, you will need a suture removal kit as well. So when you're coming to remove a PICC line, go ahead and wash your hands real good, put on some clean gloves, and then you're going to take off the old dressing, including the stat lock. After you have the old dressing off, we're going to go ahead and wash hands again, switch to sterile gloves. Once that's done, we're going to take our ChloraPrep and you're going to snap it and just clean all over where that old dressing was. Make sure to get underneath as well. Make sure the area is very clean before we remove it. Once you're finished with that, we're going to take sterile gauze, put it right over the site, and we're going to go ahead and just remove the line. If this is a central line, you want to make sure that your patient is in Trendelenburg and that they are exhaling or bearing down while you're removing it. It's not as important for a PICC line because it's coming out of a peripheral vein and the risk of air embolism is so low. But if you feel comfortable with it and your patient's awake and alert, you can have them hum so you can kind of hear their exhalation as you're removing it. So when you're removing it, you just go ahead, hold the gauze over it, and just slide it right out. Once you have it out of the patient's skin, it may not bleed at all, but remember there's still a hole in a vein a couple of centimeters below. So what you want to do is put one finger at the insertion site and go 2 fingers above because it's usually a little higher where we enter the vein, and you want to hold pressure for 3 to 5 minutes. After 3 to 5 minutes, you assess the site, make sure there's no bleeding or no hematoma at the site. Once it looks good, you're going to take a fresh gauze, put it over the site with a large tegaderm, and then the patient can remove this in 24 hours.